to be respectful of everyone's time, I do want to get us kicked off so that we have as much time as possible for the presentation. Again, I want to welcome you all and thank you for taking some time to be with us here this evening to talk about such an important topic. I want to just mention a thank you to our partnership with the Maryland Department of Health's Behavioral Health Administration and the Mental Health Association. Our group would like to welcome you to ACEs and Parenting Through Modern Trauma. My name is Amanda Kreischer, and I am the Senior Director for Engage with Skills Training Programs. The link between childhood traumas and stressors isn't really new. However, I don't think anyone would argue that today's teens are increasingly exposed to horrific events or fearful situations that bring a very different lens to the definition of trauma that their parents and grandparents experienced. What isn't happening in their community, technology is bringing directly into their lives from access to the global, wonderful world of the internet. So, the regular occurrence of everyday traumatic events have driven a surge of anxiety and depression in teens across the country. And understanding how to guide your children through this difficult period can be a tremendous relief. And this is why now more than ever, children's mental health really matters. Before we welcome our speaker today, I'd like to welcome and thank the Moore administration for their work in prioritizing children's mental health. I'm delighted to introduce our First Lady, Dawn Moore, the honorary chair of our Children's Mental Health Matters campaign, to kick off our webinar today with a few words. And I'm honored that she'll be joining us this evening to learn alongside of us. So welcome, First Lady Moore.
Thank you. Thank you so much, Amanda. And I want to thank the Mental Health Association of Maryland and Children's Mental Health Matters for today's presentation. Thank you so much for including me, but most importantly, thank you for your work and commitment to children and to our families. Yes, I am speaking to you today, both as Maryland's First Lady and as a mother of two beautiful children, Mia and Jamie. And I want my children to always be seen, recognized, loved, and supported, just like each and every one of you, no matter where they are in their own journey. And it is truly what the governor and I, my husband and I, want for all of our children. Our kids are faced with profound challenges from the fallout of the COVID pandemic. And social media, and to public safety and the fear of gun violence. As parents, we deal with the same questions that you deal with. But our children are our future, just like yours, and they're our community's future, and we need to be there for them. My husband wakes up every morning committed to making life better for all Maryland families. I want you to know you have the right person in that seat. In his first budget, he included $35 million for behavioral health services for our students. In his first legislative session, he authored and passed the Maryland Educator Shortage Act, which provides student loan payment support for mental health professionals. The people of Maryland elected my husband to be bold and to do big things. That's what he's doing for our children, and our families can rest easy knowing we have a leader in the State House. We will do everything we can to build a state that leaves no one behind. I thank you so much for this opportunity to be with you. I thank you for wanting to just continue how to be there in ways for your parents, for your children. And thank you so much for this time.
Thank you so much, First Lady Moore. Your message and your support and your presence today is so greatly appreciated. I'm enthusiastically looking forward to having you support the campaign this year and for the years to come. I now want to invite you all to join me in welcoming Dr. Erin Weiner to help us understand how traumatic events can impact a child's mental health, including an understanding of the psychological and physiological trauma-based stress reactions, and most importantly, actions that we can take to help children heal and flourish. Dr. Weiner is a board certified psychologist and an addiction specialist and speaks nationally on topics of addiction and behavioral health. His perspective is informed by his years of experience growing and directing addiction service lines for hospitals and healthcare systems, the current state of medical and psychological research, and his own observations in private practice. Dr. Weiner is the immediate past president of the Society of Addiction Psychology, on the Public Policy Committee of the American Society of Addiction Medicine, and a member of the Science Advisory Board for the Foundation of Drug Policy Solutions. I would like to remind everyone in the audience that we are recording today's event and it will be posted on social media as well as our MHAMD YouTube channel. We'll be monitoring the chat for questions and collect them to present to Dr. Weiner at the end of the presentation for him to respond to. So I will stop talking now and turn it over to Dr. Weiner for our presentation. Welcome and thank you for being here.
Thanks so much, Amanda. And hello, everybody. I'm very honored to be able to be speaking to you this evening about this incredibly important topic, youth mental health, and then specifically how we can deal with modern traumas and help support our kids in the most effective way possible in this incredibly challenging time. As we get started today, just a quick housekeeping note, and we'll head over to the title slide here. We will have a couple of opportunities to participate, and it will be a lot richer of an experience if you do participate. So I'd like to draw your attention down here to the bottom right, where you can go to our live feedback area, and there will be some vignettes that we go through today where if you're logged in there, you just go to menti.com and enter that code. We also have just put that in the chat, and we'll put it back in the chat again as we go along. But feel free to get that set up here ahead of time. So when we get there, you can participate. So that being said, we're going to start broad, talking more about what adverse childhood experiences are and why it's so relevant right now in particular. And then we're going to get a little deeper into how to understand them. And then through that understanding, what we as parents can do to support our children. So hopefully, no matter the perspective that you're coming to the presentation this evening, you'll feel like you're walking away with something that you can actually use and put into practice, hopefully fairly quickly in your work or as a parent. So let's first start with the landscape and how it looks, which is, I'll get my head out of the way here, kind of dire, not gonna lie. About during the pandemic, youth mental health suffered tremendously. 46% of parents reported a new or worsening problem, with teen girls shouldering a bit more of this burden than teen boys. More recent data out of the CDC found that about 44% of teens said that they basically had clinical symptoms of depression, 44%, and one in five seriously considered attempting suicide, which is dramatically high. What this study found underscored also that feelings of disconnection really fueled this in a major way. So you can see here on the left, the shorter blue bars mean that there were less of these persistent feelings of sadness or hopelessness when they were closer to people. And same thing even over here when we're talking about virtual connection, the closer they felt to people virtually also mattered. But these numbers are still incredibly high. And when we look at it as a whole, this is from the most recent National Youth Risk Behavior Survey. Again, we see that basically 1 in 5 teens made a suicide plan, and this has actually been increasing over time. That's what you're looking at there, longitudinal data. And 1 in 10 teens in our country attempted suicide in 2021 per their report, which is, again, a very dramatic statistic. And when you think about a classroom of children and how many of them took this action, and then what perhaps that says to us in terms of our need to support them. When I see that number, I think not that they're doing anything wrong. They're trying to deal with their experiences, albeit in a way that's self-destructive and not the healthiest way to do it. I see it as a call for us to step up and support them so that it doesn't get to this point. And if we look at anxiety, we see the same thing. About 20% of children right now have clinical levels of anxiety. This is twice as high as pre-pandemic, and it's worsening over time. This is a meta-analysis of looking at a bunch of different studies looking at teen anxiety over time. And seeing those dots move to the right as they get more and more recent is is showing this trend towards kids getting more depressed, more anxious, potentially looking for solutions. This study also really resonated with me. Came out in December of last year that found that if you look at the brain of, say, a 19-year-old now, it looks structurally different than the brain of a 19-year-old back in 2019 before the pandemic because of everything that they've gone through. There's reduced cortical thickness, larger hippocampal and amygdala volume, advanced brain age. It's not the way it should be. But here we are. And what this means long term, we still have to find out. But what it means is that the concept of adverse childhood events, I think we have to start thinking about this as being expanded, perhaps even broadened in terms of all of our children going through very difficult times in the past several years. Now, historically, what an ACE is, what an adverse childhood event is that it's a situation that happens during childhood that has a traumatic response from the child. And we'll talk a lot more about what a traumatic response means. But going through these sorts of situations creates then this, it's almost like a cross between the past and the present where you're reacting and reacting and reacting. And the categories, the 10 categories historically that we've termed as being what ACEs are physical, emotional, and sexual abuse, physical and emotional neglect. And then within the household, someone having significant mental illness, domestic violence, divorce, an incarcerated relative, or going through substance misuse in the home. And even when we just limit it to these 10 things, 61% of all Americans say that they've had at least one ACE in their life. And actually, a sizable percentage, depending on where you look. This one's 16%. The next slide will be a little bit lower, but not insignificant. 4 or more types of ACEs. And what we know is that the more of these you experience, the greater chance of negative outcomes in your life from it. And more on that in a second. If you break it down a little bit further, this was from a national study that was sponsored by CDC and Kaiser a few years back. What we found is that this one was that 12.5% of Americans had some sort of ACE, with women being higher than men, 15.2%, 9.2%. And even when you get to 1, it's a lot more closer to even, but as it starts to compound, we start to see women more than men. And when we look at the types, again, of these 10 categories that historically we've used to define ACEs, these numbers, when you really think about it, it's one of those really sobering moments to think about either how fortunate you are to have not gone through these things, but then also how common it is for others to have gone through it. In particular, when I look at these numbers of abuse, 10% emotional abuse, 28.3% physical abuse, 20% sexual abuse. And that the household challenges, the neglect, it's a lot more common than we give it credit for. And it's something that has a dramatic effect on the rest of your life. Now, we could talk quite a while just about, go through each of these areas in terms of where going through this as a child has an impact on the trajectory of a young person's life. And we're not going to spend too long on those details today. I'll list them here, and the slides are available to you. I believe they're being sent out to everyone who registered, and feel free to email me if you don't receive them, and I'd be happy or something happens there. But these are all of the different categories that ACEs can impact, and I'm sure there's more. This is just a sampling, but you can see that it's really broad, from chronic health conditions like stroke and asthma, to smoking and alcoholism, to being unemployed, depression, and these have a very significant impact as well in terms of how many people, when you do these large population level analyses and say, if we factor out the presence of adverse childhood events, if we take ACEs out of it, what percentage of cases would we expect to drop away? 44% of all cases of depression, 21 million people nationwide. We can attribute this to ACEs, statistically speaking. 1.9 million cases of heart disease, 2.5 million cases of obesity, so much. And when we think about how this impacts society, it's dramatic. And we will tell you, might be asking yourself, well, so like if someone in the house has a severe mental illness that's not being treated, like say bipolar disorder, how in the world would that be related to asthma? We'll talk more about that in just a minute. how that is related and how it flows into each other. Or I guess I'll skip ahead a couple slides and I'll say it has to do with chronic toxic stress and what that does to the body and what that does to behavioral health. But we have found all of these linkages. And if we wanted to highlight one area that the uh, reducing the prevalence of that might have the biggest ripple effect across society, it would be reducing the number of ACEs that young folks experience. And again, I think given what we're seeing out of COVID, there's a strong argument that all children might have experienced one over the past 3 years as well, those who were old enough to really be aware of what was going on. So in terms of risk factors for ACEs, and this is not deterministic, but from whatever lens you approach children, it can be helpful to understand if you're seeing a young person act out trauma, and we'll talk more about what that looks like, just understanding more of the contextual factors. Uh, so risk factors for having this are having caregivers who are or were neglected or abused themselves as children. They're young single parents or have many children. They have low education or income. They use corporal punishment for discipline. They're under a high degree of parenting or economic stress, or have attitudes that justify violence or aggression. And in terms of communities, where we tend to see more children have higher ACE scores, those communities tend to have high violence and crime, poverty and unemployment, access to drugs, and numbers of latchkey kids who come home and are letting themselves in and are relatively unsupervised. And if you have to sum all of this up in terms of what this may create, and I want to be very clear that these are risk factors, this is not deterministic. So it's not to say that if you have a parent who's had any of these things happen to them, that they are going to be turning around and creating a traumatic environment for their child. This is more a population level look at it. The feeling that creates the environment for ACEs to occur is one of chaos, instability, danger, and disconnection. And when you have a young person existing in some combination of those different factors, that's when this really starts to pop up. So let's talk now about how ACEs are so harmful, because, on their face, obviously, understandably, if someone's being physically abused, sexually abused, there's a huge problem there in that moment and around that issue. But how is it that they echo throughout time and have this huge ripple effect across the life of a person? This has to do, as I mentioned, with toxic stress. Stress comes in a few different types. You can actually have positive stress or eustress, where your heart rate might elevate for a little bit, mild elevations in stress hormones. This is when you're really excited about something. That's not necessarily going to cause problems. Then there can be tolerable stress, which is time-limited, serious stress, where it's not necessarily healthy for you to be in. It certainly doesn't feel good to be in that situation, but it's not going to create this very negative effect across your life course. The part where ACEs come in is this toxic stress, where you have a prolonged activation of stress response symptoms, and then you have this absence of protective relationships. And when you're constantly in that place, there is something that happens within the body and something that happens within the mind that makes it very difficult to be as healthy as you can be. And in many cases, start acting in unhealthy ways. So if you think about the ripple effect, and actually this pyramid could go even deeper when we talk about intergenerational trauma and systemic issues that cause people to suffer from one generation to the next. You can start with these adverse childhood experiences. That leads to, because you have all of this cortisol, the stress hormone coursing through your veins, you're scared, you're tense all the time, that disrupts your neurodevelopment, quite literally. That's when you go back to that slide we read earlier about the brain development. Chronic stress affects the brain, which leads to social, emotional, and cognitive impairment, which can lead to the adoption of health risk behaviors, which can lead to disease, disability, and social problems, and then truly early death. ACEs are a predictor of early death. So none of this is a given, but you can imagine that if you have a child, they can go all the way to the top of this pyramid. Because if you have a young child who's going through all this trauma, and then they end up, say, falling into a group of friends, say, who are doing antisocial behaviors of some sort, and say they fall into using substances, and that becomes a big part of their life, and then they don't do well in school, and then that selects them into a different these life choices start to add up and can lead to places where their bodies will not be as healthy, their brains will not be as healthy, they will not be on the same trajectory as they otherwise would have been. So the the mental process around trauma that I want to take a second to talk about is how the brain functions differently when under a high stress burden. And the best way that I can describe the best diagram that I have for how to describe this is that of a dog driving a car, a modern car, in this case a Tesla. And this I know it's not the most anatomically correct picture of the brain here, but it's the best analogy that I can think of. And here's why. You can imagine, again, we're going to paint in some broad strokes here for a second, that we've got two main forces in our brain when we're under stress. One is the thinking analytical side, and it's actually what separates us from animals, like that little guy behind the wheel of the car. It is our prefrontal cortex, and it's where we house our executive functions. This is a broad range of cognitive abilities that allows us to do things like think critically, have empathy, take the perspective of others, think abstractly, moralize, think about long-term gain versus short-term escapism. All of these things are in the prefrontal cortex. It is incredibly advanced, but as advanced as it is less powerful than our old primal brain, our limbic system, which is the system of our brain that is responsible for our urges, for our emotions, for our drives. And one of our primary, most primal drives is to not experience pain and discomfort. That is objective number one. If we are in pain, if we are feeling uncomfortable, that part of our brain says, oh, no, 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 and does what I like to call the dog taking the wheel of the car. And it says, we need to feel better right now. And then you do things sometimes that aren't actually in your best interest, but create a sense of peace in the moment. So to give you an example of the dog taking the wheel of the car, imagine if you've ever been angry at your spouse or a significant other, someone in your life, maybe even a child, say, who's just gotten on your last nerve all day long, and you end up, you're feeling tension, right? You're feeling all this tension inside, and sometimes, even if you love the person, you might get angry in a destructive way. You might yell, you might snap, you might say things you regret. What's happening right there is you're not thinking, how is this going to affect my loved one? You're not thinking, how is this going to cause problems? What you're thinking is, I feel tension. Maybe this person is hurting me with their behavior, and I'm going to stop that right now. I'm going to take charge. I'm going to protect myself. Maybe even I'm going to expend some of that energy I have inside. That's that limbic system saying, we need to express this right now. I want to stop getting hurt. This is also the process by which a lot of people fall into addiction, for example, where they're feeling all this tension, they're feeling all this stress. And so the idea of some sort of temporary euphoria sounds like a great idea. It seems like that part of our brain, the dog behind the wheel, loves that, because actually its second prime directive is maximize pleasure. First thing, don't die, don't get hurt. Second thing, feel as good as you can. So like intoxicated euphoria sounds like a great idea, even if it's actually not. Even if it means that it's going to cause problems between you and your parents, even if it means it's going to break trust with your wife, even if it means you might be using street drugs, which these days are more and more often laced with fentanyl or xylazine. But you're not thinking of those things in that moment because you just want to feel okay. And that ultimately, when we get to ACEs and how to understand them in kids, is a really important aspect. That they're coming from when you see someone, adult or child, acting in a way that seems to be counter to their best interest, or that seems to be really activated or intense, it's actually coming from a place that makes sense. You just might not understand what that is. Whatever negative consequence they are getting from that action matters less to them than the benefit that they're getting from that action. We are very utilitarian at our core. We like to maximize benefit, or if it seems like someone is doing something self-destructive, there is a reason for it. Now, if we come back here to this idea of toxic stress, it tends to stick around for a reason. Why does it persist? Why does it stick around? So when you think about trauma, the biggest difference I can give you, the easiest way to think about the difference between a traumatic response or a bad memory, or a traumatic memory and a bad one, just having a bad memory, something bad that happened to you, is that your body responds to the situation that you're experiencing now as if you're in the dangerous situation you used to be. So you see something that's similar. Maybe it's, say, for children, an authority figure. If your authority figure at home is someone who does not feel emotionally or physically safe. Maybe it's someone with the same name. Maybe it's a certain sort of environment. Whatever it is, there's a similarity there. And so you react to that similar theme or similar characteristic as if you're in danger right now. And you have adrenaline going through your veins. You feel incredibly stressed out because you think it's happening again to you, or that even that it could happen again to you. If you have a child, say, in foster care who is removed from parents who were being abusive, if they are mistrustful of their foster parents, it may be because in their mind, here's more parents. I know what parents do to me. I don't think I can trust these people. And that's the rule that's been learned. An example that I like to use when I'm working with folks in therapy around this is we call it firemen at a barbecue. And what this means is that for a fireman, they know exactly what to do when they come to a burning building. They kick down the door. They come to the house. There's fire. There's smoke. There's people inside. They break through. They breach the entrance. They clear each floor. Adrenaline's pumping. They know how to handle that situation. That's how they're trained. However, when a fireman goes to a barbecue, despite the fact that there is fire, smoke, people, and a house, they don't kick in the door. And that's because there's a critical difference, right? Contextual difference between a house fire and a barbecue. But when you've been traumatized, you don't see it. The past feels present now, and it feels as if it's happening again because there's so many of these similar characteristics that it sets off that trauma response. Avoiding these situations then starts to feel very important. And that's another example of your dog taking the wheel of your car. So if you see a situation where you've been hurt before, then you might have this very intense avoidance response. Like, say, I've seen this happen before when there's someone, they've been driving along, they think everything's fine, and then out of nowhere they're hit by a drunk driver, or a deer jumps out and they end up hitting it and it's extremely traumatic to them. Then they're afraid to drive afterwards, potentially. Why? Well, because in their mind, I got hurt while I was driving. When I was in the driver's seat of my car, I very nearly died. They're thinking driving equals danger, when that might not actually be the case. That might have been, say, a very low probability occurrence. But even regardless of how probable it is, avoiding it feels really important. So when they get in the car, they feel tense. They feel tightness in their chest. They feel like they want to get out, run away, the panic response. Because their brain is saying, you could die right now, even though there's a critical difference between what happened before and what happens now. Avoiding internal reminders may also feel really important to folks who have been traumatized or have gone through ACEs. An internal reminder means memories, because memories and negative narratives can trigger the adrenaline. And this is where avoidance can come through substance use. Sometimes it's staying incredibly busy so you don't have time to be in your own mind, being really absorbed in screens and social media, but basically never actually being alone with yourself. Because if you are alone with yourself, then you have to think about what happened. And that creates this intense discomfort, which our limbic system, the little guy behind the wheel of our car, doesn't like. So if you have in your palm of your hand, TikTok, where you can just constantly sift through meaningless videos that suck away time and make it so that you don't have to think about the things that are torturing you, that seems like a really great idea, even if there are a lot of downsides that come from that behavior as well. So I want to take a step back from the theoretical and actually move more down to trying to really make it real and help apply these ideas. So we're going to go to our first vignette, and I'll read it off to you, and then I'll head over to the side where you can put in a response. And actually, I'm going to go ahead right now and bring up the place where you can respond to it if you'd like. But you have a relatively stable life. This is the vignette. But your mother and father always seem to be working and don't seem interested in spending time with you. You come home from school to an empty house and generally entertain yourself playing video games until your parents come home around dinner time with takeout. Everyone in the house eats separately, and when they feel like it, and usually spends the evening relaxing by themselves in whatever way feels good to them. Your parents almost never come to your soccer games, which is an activity you're very proud of. So please now, if you haven't already gone to Menti, head over there, and the link that's in the chat, which I will also put in here again now, you can click, head over there, and I'm going to bring our screen over there, and think about, what I'd like you to answer is, what emotions might this situation evoke in you? And let me pull that up over here. Here we go. So thank you for those who have responded so far. Please go ahead and put it in. And we'll build a little word cloud here. So I'm seeing like loneliness is a huge one for us. Disappointment, fear, resentment. So we're going to talk here in these two questions, one about emotions, which is what we're doing here, as well as thoughts and messages and messaging. Because understanding why a child is acting the way they are is incredibly important to working with them effectively, to being able to actually get to the heart of the issue. So it looks like loneliness is still leading the pack. Disappointment, sadness, fear, resentment. Unimportant. Yeah, so I'm seeing some self-judgment in there, right? With this idea of feeling unimportant, abandoned. What's wrong with me? Parents don't care about me. Some grief and pain, lonely, unloved. Yeah. So something about this one in particular, and we'll thank you for everyone who's still responding. I really appreciate it. It really makes for some rich responses for us to look at here. Is that this vignette, I don't think is all that uncommon, particularly with parents who have to work and have to be busy. And just when we think about the economic climate we're in and the challenges that families face every single day. And it's so hard then. But if you think to yourself, and this is going to be a theme just generally for parenting, but certainly when we're dealing with something as difficult as trauma, how do I speak to the emotional undercurrent between me and another person, or between me and my child? What will not what do I think my behaviors say to them, but how does it seem like my statements, behaviors are landing to them? And for these parents who might mean incredibly well, even within whatever structure they have in their life, maybe there's something that they could be doing differently to make it so that these are not the feelings, that if this is what a child sees day after day after day after day, right? Because remember, this is repeated literally hundreds of times a year, 365 potentially days a year. They're getting a message over and over and over again. It makes an impact. So here's my second question for you about this particular one. What do your parents' actions say about you? So if the first one was more about how does it make you feel? What's your takeaway? This one, what does it say? So imagine a thought, like you could put whatever you're going to write right now down in quotes. So please type that in, and we'll see what everyone thinks as it comes in here. I'm useless. I'm not valued. Not worth their attention. I'm not important. I'm not good enough. I'm not a priority. Mistake to be born. That's intense. I've heard that from quite a few of my patients, actually, that they've even explicitly been told that it was a mistake that they were born. My feelings don't matter, not their priority. So as we read through this, and we'll get at this a little bit more in the next vignette, which we'll talk about in a second. Just think for a second also. So like these are the messages that these young people are receiving day after day, potentially unintentionally. What do they do about that? How does this make them feel? How might they react to this over time? And what might the end result be? So thanks again for everyone who's responding. Let's do one more of these. I'm going to bring us back to vignette here number 2. Or maybe not back, but over to vignette number 2. So You are afraid of your father. You feel yourself tense up every day before he comes home around 5:30 because he's almost always angry when he walks in the door. He can't take out his anger at work, so he finds reasons to take it out on you and your younger brother instead. A poor grade, having a mess in your room, there's always something that sets him off, and is worse if he's been drinking. You do your best to avoid punishment, but you can't really predict which days you're going to get yelled at. And on really bad days, you get hit. Your mom doesn't hurt you, but a part of you feels betrayed because she sees what your father does to you, and she never steps in to stop him. So we're going to start with the same question as last time, and then we're going to go to a different one. Again, so this is happening to you. What do your parents' actions say about you? What message are you taking away from this? If this is when you're looking at your father's behavior, at your mother's behavior. And I also want to make it clear in this example, which I put up here because this is a story that I hear very often. This is not, I don't mean to be blaming or accusational towards the mother in any way here. I think that there's a lot of feelings that, and a lot we could talk about in terms of what it's like to be in those sorts of environments. But for this particular example, we're really just sticking with the kid's perspective here and what the child might take away from this sort of situation. So, I don't matter. No one protects me. My life is not worth it. Yeah, not valued. They don't love me. Punching bag, not a person. I was getting punished, and my dad hates to be here with me. Mom doesn't care about me. I can't do anything right. I'm unworthy of love and protection. See that? What am I doing wrong? Can't do anything right. Not valuable. Yeah. One thing that I haven't seen yet, and we'll see if, and thank you again, everyone, for your participation. As more responses come in here, is no, I don't want to jump. I jump in front of anybody. I need to try to be perfect. This one is another one that absolutely. Another just quick note about the way this tends to work is a lot of times when there's people who and I don't mean to make an overgeneralization here. I want to put that out there, but a lot of times when folks say that they're just a very empathic person, they just feel things very strongly. What I found is a lot of times that is the case because when they were a child, they were trying to be as aware as possible of every emotion in the house. Because when that started to turn, that was a way that was a way to keep themselves safe by being hyper aware of others' feelings and trying to be perfect, trying to control everything they could and be aware when things changed. That was that small little way of trying to be in control. So that trying to be perfect, that's a huge one. So one thing I'm not seeing here, but all of these absolutely, mom is scared. I have to be aware I'm broken. Is the idea of this is kind of getting at it. I'm a bad kid. I must deserve this. Why do my friends not have this happening to them? Right? Well, this if this is not how parents are supposed to act, maybe there's some reason, and this has to do with me. So as a final question, just another way to look at this. 4 hypotheticals for you. How likely is it that this chronic trauma could, and just rate this from very unlikely to very likely, change how much you trust authority figures, teach you that you must be perfect to avoid getting hurt, lower your self-esteem and foster a sense of powerlessness, and make you want to feel powerful then in other ways when and how you can. And as we answer this, we'll see how everyone feels about this. But you probably noticed when I put this in, I wrote them in a way where, yeah, there's a pretty solid chance that all of these things could be true, right? Maybe some more than others. But so the question then becomes, when you look at children who have been through difficult circumstances, and again, I really want to underscore here that COVID itself, based on what we're seeing with 1 in 5 kids thinking about suicide and 1 in 10 attempting it in 2021, how else might kids be trying to deal with the trauma in their life, whatever shape and form it may take? Because this is something that we all are trying to feel okay somehow, right? We lower our level of trust. We're not going to be hurt as much when we feel like someone betrays you. if you think that you can, if you get straight A's, you're not going to get hurt, or if you say just the right things, you're going to be extremely anxious about doing everything perfect. If you feel bad about yourself or feel powerless, like you can't control anything, then you might as well just give up because you are going to get hurt anyway. Well, then, yeah, you might give up, right? Because then you don't have that issue of having your hopes dashed all the time. Or maybe you take power where you can. That's when there's that cliche that you tell the kids who are being bullied that, like the bully has low self-esteem. Like it is actually true, right? Kids who hurt other kids are absolutely hurting themselves. They are putting others down to feel good about themselves. Doesn't necessarily help the kid being bullied, necessarily, but it's a sign that something is wrong. But not that it's not, that what's not wrong is the need to feel like you have control over your life, to feel good about yourself. The question comes back to, and when we talk about parenting approaches, more of how can you help a child do this in ways that are healthy and pro-social rather than destructive and antisocial. So why this sticks around beyond this, they result in learning specialized coping behaviors to attempt to control their situation, create a sense of safety. So we talked about this idea of being hyper aware of the emotions of others, needing to please or be liked, being highly conflict avoidant, just don't rock the boat, no one will look at you. Dissociating, so kind of disconnecting from reality or avoiding stressful situations. Not trusting others, especially authority figures if you feel like they're not going to have your back. Hoarding resources if you feel like you're not going to be able to get them again. Hurting or pushing away others before they can hurt them first. The perfectionism that we spoke about. And also sometimes self-harm, because they either want to feel something or they're going to be the ones who hurt themselves. Eating disorders, because that's also something that you can control. That's a big part of where eating disorders come from, is it's just another way of trying to modulate your emotions and to feel okay. And so the child then, what locks these beliefs in place is they think that they're okay because of all of this stuff, because it works sometimes, or maybe in their mind a lot of the time. And they can't learn to trust. They can't learn to see that the present is different from the past, because they think the present now is different because they're doing this sort of stuff. Dissociating from reality, hoarding resources, not being trustworthy, being adversarial or oppositional, feeling better about yourself because the number on the scale keeps going down, getting a group of friends who all like to get high together, and then you're gaining social acceptance and the connection that you were lacking. I could go on, right? There's so many ways that this happens, but then what's happening is that the child becomes very attached to that way of meeting their very reasonable emotional needs instead of ways that are actually healthy. So the other way that this tends to stick around is when you get new information and you force it into the way you see the world. So I alluded to this a little bit earlier. So imagine if you have the just world belief, that you think that if good things happen to good people, well, then what does that say about you? Right? Or the idea of I've been damaged forever because this has happened to me. No one will want me. If I was a better kid, this wouldn't have happened to me. I'm unlovable because this occurred. I must just be someone who doesn't deserve respect because I keep being disrespected. And this creates a narrative that makes sense or feels controllable, even if it's not true or if it's very negative. And this is another one of these just human preferences that at least I found in my own practice, is that the need to have certainty, like the reason why I keep getting hit is because I'm not a good kid. That feels better than feeling I am out of control and I don't understand why this is happening to me. Having anxiety about a situation, sometimes assuming it'll go poorly or it could go poorly, feels better than complete uncertainty, even if that creates anxiety inside of you. And so because we as humans like to be able to control whatever we can so much, we sometimes grab onto these narratives and ideas that make sense, even if they're hurtful and maybe not even true. And this gets back to, again, a really core aspect to understanding why this works the way it works. The behavior is purpose-driven, even if it doesn't seem to make sense. There's always a reason behind your child's behavior. If they are mouthing off, if they are being distant and withdrawn, if they like something, and they choose to do it, there's always a reason. It's meeting a need in that moment. And particularly if you're noticing that they're continuing to do something, even though it has a negative consequence attached to it, that must mean what they're getting out of it is really important to them, usually on an emotional level. Because unhealthy coping, it comes from intense discomfort. So if you think about emotions being on a spectrum, everything from really, really good to really, really bad. And in the really, really bad category, this would be things like fury or clinical depression, panic attacks, chronic anxiety. But even more in this general vicinity, you might see some of these unhealthy coping styles pop up because by doing them, there's been this system created, this psychological system created, where someone gets benefit from doing these things like nervous tics or addictive behaviors, eating disorders, phobias or avoidance, anger and snapping, unhealthy relationships. All of these generally are ways of people just trying to balance this out and get to at least here, right? If not here, if only for a short while. So when we think of children's behavior, particularly those second traumatic cycles, instead of thinking of it as bad behaviors, I encourage you to think of behaviors as the tip of the of the iceberg. And Dr. Stuart Shanker has a great model for this called self-regulation, where he says that unexpected behavior, again, is the tip of the iceberg. And if you see that, this unexpected or antisocial type behavior, you need to start thinking about, okay, where are they getting stressed out? Where are they spending all their energy so that they can't deal with new stressors very well? And he breaks it down into 5 different areas: biological stressors, cognitive or thinking stressors, emotional stressors, social stressors, and then pro-social stressors, or what society expects of you, and what your parents might expect of you. And for certain people and certain kids, some of these areas might be really difficult and very hard for them. And what's happening is when they're acting out, this is them trying to complete their stress cycle. They're trying to feel okay and regulate themselves and deal with whatever that intense need is with this sort of acting out behavior. And so when thinking about how do I best work with my child or with a child, focusing on the why of the behavior, not the what, or not just the what, is really important. A lot of times there's a strong fixation on the behavior because it might be very disconcerting to the parents or embarrassing for the parents, perhaps, or just the behavior itself as disturbing. And so there's this focus on, I need to stop this behavior from happening. But there's not enough focus, or maybe even any focus, on why is this behavior happening in the first place. And unless you go upstream to that point, unless you go under the waterline, whatever metaphor works for you, you're not going to get to the core root of the problem, and you're just going to see it repeat itself, maybe with different types of coping behaviors. Or for high school seniors, they're going to go off to college, and when you're not able to monitor them anymore, then they're going to do it. So if a child is burning all their energy on being activated and coping with their existing stressors, they're going to respond poorly to new ones. And so being able to, again, get below that waterline and help them speaks volumes and goes a very long way. So let's pivot now to the last portion here. We talked about what's going on broadly about mental health first. Then we've just talked about how do you understand what's driving this behavior. So lastly is this question of how can we create this sense of safety? How can we help kids as they're going through a time that is very challenging? They've been through a challenging time. They are still in a challenging time. And so what we can do to help as caregivers and just caring adults is the last portion that we're going to talk about today. So the first thing that you can do is stay connected to your child if you're a caregiver and know the signs of possible ACEs, of possible adverse childhood events. And I want to really highlight this word for a second, of stay connected. And I don't have a slide on this or even another bullet, I don't think. But if you don't know what normal looks like, you are not going to know when it changes. And so it is so hard. It is so hard to really stay connected to kids. I know that I am very busy, and it is very difficult even some days to even just have more than just dinner with my children and with my family until the weekend. And so it is so hard. It is so hard to do that. And you still really have to. You have to find some way to stay connected, because if you don't know what normal looks like, you're not going to know when it changes and when there's signs of emotional distress. These signs, we can break it down into two main categories: internalizing signs of distress and externalizing. So signs that are more them kind of falling into themselves and being more withdrawn, and ones that are very outwardly projected or externalized. So on the internalizing front, you might see academic problems, difficulty sleeping, difficulty concentrating, the child shutting down, social withdrawal, somatic problems, that means body problems, things like headaches, stomach aches, feeling sick. They might be spending excessive time in social media or games. And I again want to mention this is relative to their baseline. So if for whatever reason you have a child who spends a lot of time on that anyway, maybe that is a sign of emotional distress. But if it's not, this would be an increase in that. And then certainly self-harming behaviors, again, usually is a very severe way of a child saying, I have a lot of feelings, I have no idea how to express them, and this gives me some sense of relief. On the externalizing front, that you might see moodiness and defiance, alcohol and drug use, extreme sensitivity to criticism. Before we get to that next one, the reason why you might see an extreme, like very high sensitivity to criticism, and this goes for adults as well, is that if you have an internal monologue that's really critical and you are believing something about yourself that you really don't want to believe and that really drags you down, and then someone else says it in the real world, that feels awful. That's like confirming your worst fears about yourself and that other people see it in you. And that can feel extremely threatening. And so that's where if you see someone react really strongly in a moment when it seems like yeah, like maybe something, but that's like a few degrees extra, that can sometimes be what it's about. The high level of physiological arousal and startle reflex, this is honestly a very common sign of trauma. And is so like if you were to say tap someone on the shoulder, they have like a really intense jump startle response, or they get really unhappy, like really unhappy about that. Sometimes that means that they're essentially feeling in danger and edgy all the time. And so the fact that you've snuck up on them is very, very alarming and dangerous. Reckless or self-destructive behavior. So it seems like they don't value their well-being or their life that much. Or violence or more traditional, just acting out if they're externalizing that way. Specifically, if you see signs of depression, can be if you see a child saying negative thinking, expectancies for their future and comments, if they're saying negative things about themselves, if they're not enjoying activities that they normally would enjoy, if they're crying a lot. On the suicide side of things, and we can honestly spend an hour just talking about this. It is National Suicide Awareness Month, so definitely a good time to talk about it. But just very briefly, if you see anything that looks like suicidal thought statements or writing about death or suicide, particularly in a positive way, but even just at all, it's not uncommon for to go through thought experiments. But if it seems like it's either like they've got a plan, or they're talking about it in intentional sort of ways, or it's something that comes up a lot, or they're saying things like how much better it would be if I was gone, or I'm a burden on everybody, it would be easier if I wasn't here. Take those comments really seriously, because that's really kicking it up a notch in terms of a risk for a child acting on it. And again, I want to underscore 1 in 5 teens say that they seriously thought about killing themselves last year, or in 2021 rather, and 1 in 10 tried it. So we got to take it really seriously. If they start giving away valued items, that can also be a suicidal indicator. On the anxiety front, just a general sense of overwhelm, kind of feeling flustered. A lot of the time, if they're avoiding certain activities or groups, that can also be a sign. Or if they're having panic attacks. So exiting situations, seeming really like heart racing, hot, clammy hands, just really squirrely, like they need to leave. That could be a sign that they're having a panic attack and that there might be an anxiety problem to work on. These are very common, I should mention, in kids with ACEs, to have that, as well as eating disorders. So signs of eating disorders, there's a greater percentage of girls than boys who have it. I believe the split is 80-20, but still 1 in 5 kids with an eating disorder are male. So it is something we all have to watch. We have to watch out for everybody. But a preoccupation with food or weight, body dissatisfaction, there's usually an emphasis on control. So you're going to see this a lot of times in young people who struggle to control other elements of their life, like say being in traumatically stressful situations a lot. Skipping meals or excessive exercise, you might notice weight change. You may also notice binging. Sometimes young people will use food to control their emotions, not by lowering their weight, but by creating a sense of pleasure, or their discomfort is escapism by eating well after they're full. Leaving after meals and then spending excessive time in the bathroom could be if they're purging. So that's what bulimia is about, where you eat a bunch of food, but then you vomit it back up before you can really can digest it. And another sign of bulimia, because of that vomiting, are cavities or enamel erosion. So if it seems like a young person, if you're seeing some of these signs and then they're also getting a lot of cavities, that's because all that gastric acid is coming up and coating the teeth. So again, I know that was a whirlwind overview. A quick shout out for mental health first aid. If you're interested more in learning about what to watch for different psychiatric problems and behavioral health problems, that is a great group and a great learning set to learn more about that. Now, the next most important thing that you can do is be safe to talk to, including about difficulties and failures. Because if you are not a safe person for your child to talk to, they're not going to talk to you about the things that matter, that they're most insecure about. So to do that, you need to demonstrate emotional safety. And this is really important. You don't tell a child that you're safe. You show a child that you're safe. All our emotional side of stuff, that limbic system, that dog behind the wheel of our car, just like a real dog, it actually doesn't understand English. It doesn't understand logic. You can train it, though, through pairing experiences. Like something happened, like how do you train a dog to sit? Right? You say the word sit, but then you put its butt down and you give it a treat. And then eventually it puts its butt down and gets a treat. It learns to sit through that reinforcement, that positive experience. That's the way our limbic system works too. So if you want someone to feel safe around you, you need to be safe around them consistently over time. And the best way to do that is how you communicate with them. And there's a great acronym for this. I did not make it up. I just really like to use it. It's called Communicate with Love, which stands for listening, offering, validating, and empathizing. So briefly about each of these. Listening means active listening. So you can't assume that a young person, or anyone else for that matter, is going to know that you are really listening to them unless you show them that. And there's a number of ways you can do that. Two of the easiest ways to do it, though, are with open-ended questions and with reflections. An open-ended question is a question that requires a response that includes detail. So an example of a closed question would be your child getting into the car after school and you ask, did you have a good day at school today? Yes. Or even, how was your day at school today? Fine. How sometimes can be actually an open-ended prompt, but in that case, maybe not so much. What would come across as open, though, and ask for more detail is, what's the most interesting thing that happened at school today? Or what's something challenging that happened at school today? And even if your child doesn't take you up on it, just asking the question shows that you care. And if they do, then they're sharing their experience with you that maybe even has some emotional impact. And that's when you can show that you're listening through reflections, as well as what you're seeing in this picture with eye contact and body posture sometimes. Like if you're in your phone, if you're looking at text messages, that communicates something to the person you're with. But even beyond that, you can reflect back to someone that you've heard them by giving their information back using different words. So, for example, if your child gets into the car and says, "Oh man, I got a C in my geometry test today," and you see the look on their face, and you know that they studied, and maybe you say back, "Oh man, I'm so sorry. You worked so hard on this. You must be so frustrated," or something like that. What that does is it shows that you heard what they said, and maybe even that you have other contextual knowledge. You could also ask, "Oh man, you got a bad grade on your test. How do you feel about that?" Like, instead of, if you don't want to put an emotion in their mouth, that shows that you listened. It shows that you heard, and it actually prompts someone to talk more, which then you can reflect back or ask a question about again. This, by the way, this active listening, this is like hashtag therapist tricks 101. Like, this is the core. We call these therapy micro skills, things that we just do in conversation. But these are skills that anyone can do that help someone feel heard and like you're really there in the room with them. So active listening, really important first step. Offering has to do with how do you offer guidance or advice. And this is another area where parents can sometimes get really tripped up, particularly with teens, where you come across as pushy. And when you push, that's when your teen can push back. So a great way to do this, again, this is right out of the therapist handbook, is something called a feedback sandwich. And what this means is you sandwich your guidance or your feedback within 2 slices of autonomy and choice. So the first slice, if you will, is you ask the child for permission if you can tell them how you feel about something or give a suggestion. Now, obviously, you can't ask for permission if you have to tell them something. So don't, give them a choice and then blow past it. That's really disempowering and disconfirming. But if you can, you could say something like, "Hey, so I've got an idea that could help here. How do you feel about me telling you? Or can I share something that worked for me in the past?" By doing that, what happens is if they say yes, then they literally asked for your advice. So you cannot be pushing. It's the opposite of pushing. If they say no, again, you got to respect that and say, "Okay, no problem. You change your mind, let me know." Um, but if they ask for it, then they've literally asked for it. So then you provide that information, you provide that guidance, and you follow it up by asking how they feel about it. You can even literally say, "How do you feel about that idea?" And it really is okay to disagree if you think you'd want to handle it differently. What happens if you do that is that if they take the advice, they will have asked for it and they will have agreed with it verbally. And what we know from research is that this makes them far more likely to actually follow through with that after the fact than if you're like, "Well, here's what you can do in this situation. Here's how to handle this. Here's how you should think. Here's how you should feel." So give that a try. Ask permission, provide guidance, ask how they feel about it. It's very respectful of someone's autonomy, gives them that control, which again, as a kid, you don't get a lot of control. There's a lot of things about your life that are laid out for you. And that's important, right? Kids do actually need that structure, but at the same time, giving them things they can control actually helps them a lot with their self-esteem and their self-efficacy. The V stands for validating or letting someone know that their feelings are okay, which you can do, by the way, even if their behaviors aren't healthy. You can tell if you have a child, for example, who discloses to you that say that they're vaping or that they're using THC products. And even if that is something that is objectively unhealthy and potentially harmful for them, you can first go to a place where you can talk to them about why that's happening. Or if you discover this, right, you can ask them what's going on, what's behind this, and respect the fact that they're trying to meet a need. Maybe it's social acceptance, maybe it's calming themselves down, maybe it's trying to help themselves sleep, maybe it's anything. But validating the feeling behind it and that you can understand where they're coming from on an emotional level creates safety, even if there are negative consequences or boundaries that need to be set. So letting someone know that their feelings matter, it goes such a long way. Like never has anyone ever, like if you've been in an argument with someone and someone said like, "Stop overreacting, why are you so sensitive?" Like you never been like, "You know what, you're right, I just your view of this is the right one. I am just oversensitive and my feelings don't matter because I'm a kid." Even, right, if we want to go to the teen, like I don't know enough, I don't have enough life experience to even have an opinion about this. Thanks, mom. Right? Never. And that, it sounds ridiculous to even say, but when we don't explicitly validate, or even worse, if we invalidate, that creates a very emotionally unsafe situation. So it's possible, again, to speak to emotional safety without endorsing a behavior or without being permissive about something that really can't happen. And lastly, empathizing is very close to validating. There's a lot of overlap in that Venn diagram, but that has to do with showing someone that you understand how they feel and that you can, to borrow a phrase here from Brene Brown, be in the hole with them. If someone's in a dark hole, they usually don't want someone to ride in on their white stallion and carry you off to safety. What they want is for you to just sit with them for a bit and show them that you understand, hold them, hug them, be there with them. And then maybe, ask if you could share an idea that you have or, start that feedback sandwich. But first you want to be down there with them and don't rush it. Seeing somebody, to borrow a phrase from Stephen Covey, who actually will come back in 2 slides from now, or somewhere around there, that being heard feels like a breath of psychological fresh air. It creates a profound sense of safety. So that's what this slide is really getting about. And as a final note about this, if you do not have a relationship with your child where there is a lot of demonstrated emotional safety, where they disclose these things to you and they're very close with you, have persistence and don't get discouraged. Because again, safety is something that is shown consistently over time, not told. You have to do it over time. So this is how you get there. And sometimes you do have to have a third hand, like a family therapist or something, to jiggle something loose. But this is the formula in terms of how you create emotional safety. So I want to talk for a second about just some very pragmatic guidelines for kids who have gone through what I'm calling modern traumas. And by modern traumas, I mean there's a lot of things going on in the world right now that are very disturbing to them. And for good reason. Suicide rates are a lot higher than they used to be. Overdose rates right now, the demographic group that's the highest right now in the country, increasing, is 12 to 17-year-olds. School shootings are a lot more common than they used to be, as are the drills. There's a lot of political unrest right now. I don't remember the statistic, but it's alarmingly high about how many kids are actively affected by climate-related anxiety every day. So there's a lot right now that's going on that's very concerning to young people. And so it's hard sometimes to know as a parent what to do about that. And so I want to talk about a couple steps here that you can use to help in these situations. The first step, as I say right here behind my face, is to release the tension and stress. So that means first, how do we let that tension out? And that first step is be aware of your own reactions and be in a stable state of mind about it. So if this is something that happened very recently, you've got to make sure that you are in a good place to talk about it, because kids will tap into your state of mind. To give you an example, I actually live about 15 minutes away from that July 4th shooting the year before this one, 2022, in Highland Park, Illinois. I'm right by there. And so that was something that was very raw for obvious reasons around here for quite some time. And so if that's something that disturbs you, as it would for most of us, to have a mass shooting in an affluent suburban community where you never think those sorts of things are going to happen on a July 4th parade, you've got to make sure that you are in a place where you can speak about it before passing that along to kids. So make sure that you are in a stable state of mind. Then you want to ask them what their thoughts, feelings, and concerns are. Don't assume that you know, because one, you might not. And by asking a leading question, that might actually stifle their ability to express themselves. But two, you might just straight up be wrong. There might be aspects of this that you haven't thought of. So what have you heard? How are you feeling? You want to make sure that you're honest and talk about all sides of an issue. Kids, particularly teens, know when you're leaving something out, and that really undermines your credibility to help someone through something. That undermines that sense of safety. If you're sugarcoating it, or you're making it seem better than it is, or you're not acknowledging and confirming their fears, you got to make sure you talk about all sides of the issue, ideally as accurately as possible. You don't want to feel like you need to talk about everything all at once, or that you need to fix anything in that moment when you're trying to release the tension. This can be something that happens in stages. This can be something that in the beginning, again, you don't want to try to necessarily make better. Your main goal is to just get those emotions out so they can be processed. That point as well, by the way, is true all the way up through adulthood. There's a lot of adults who struggle to do just that, to actually get out their emotions, to process them. It's okay if the discussion upsets them. It's natural. Being upset is a way of expressing yourself, particularly if it's done constructively. And you want to normalize that. It's okay to feel, to cry, to be angry, to feel hopeless, at least ideally at the start. Hopefully we can do something about that. But at the start. And it's also okay if they don't want to talk immediately. You want to let them know that the door is open and that they can choose to talk when they're ready to talk. So the second step is to refocus. So first you get that feeling out, and the second step is, where do you take them? So the first is you want to discuss the understanding of risk, because a lot of times, and I alluded to this when I talked about that example of driving, a lot of times people get worried about something really traumatic happening again, if it happened once. So that was something I actually worked with someone who was in the July 4th parade that got shot up. And uh, one of the things that he did intentionally was go back to downtown Highland Park because he needed to train that out of himself, that that is actually an okay place to be. And that was a freak occurrence. And it's true. There has not been anything like that since, because that was a freak occurrence. But this idea of because there's a risk means it's going to happen, versus there's a risk and we need to be able to be aware of, probability, but also look at it in a measured way. That's sometimes something that is difficult for kids to grasp, but is very helpful for them to grasp. The second is to focus on what you can control to reduce risk versus what you can't. This is again borrowing an idea from Stephen Covey, but he talks a lot about this idea of your circle of concern versus your circle of influence. And your circle of concern are all the things that you care about. And that is always greater than what you can actually influence, what you can actually do. There's all sorts of things that we care about in this world that we can't do anything about. But the question is, where do we put our energy? So the people who spend a lot of time in that circle of concern, worrying about things they can't control, actually tend to shrink their circle of influence because they just spend a lot of time worrying about things that they can't control. But the flip side of it is that if you put your energy into your circle of influence, where you can control to reduce your risk of something bad happening, you might even find that that circle of influence increases as you put consistent work into it. But even just differentiating between your circle of influence versus control helps a lot. You can also create or reflect on learning experiences rather than just keeping it as ideas. So instead of just going through an idea in your head, like here's a way of thinking about the situation differently, you can take action and do something, have an experience. Because again, experiences are the language of our limbic system, of the dog behind the wheel of our car. It learns from experience. That part of our brain learns from experience. So the more you can get somebody out there, I could talk to that patient all day long about how Highland Park downtown is actually a safe place to be, even if it wasn't on that day. And there may still be a tremendous amount of fear until you go back and desensitize yourself to it, because logic is not how fear works. Limiting doom scrolling, which is going through all the negative news items, of which there is a lot, cutting down on that, putting that energy again towards things you can't control. And ultimately, you want to suggest productive, pro-social, and proactive ways to discharge and act out feelings to make positive change. Okay, you're concerned about this social issue. What can we actually do about it? At least in our community. How could we start? What's one thing we can do to get an idea or a message out? That's when we talk about, after we release the energy, how do we refocus it towards something positive? So getting back again to what we can do, you want to stay connected, you want to be safe to talk to. You also want to create resiliency through healthy connections to others. And so this includes social connections. So really making sure that kids are a part of the household, not apart from the household, which can even mean doing things they like to do, like playing video games. That actually shows that you care about their interests, right? You're going to go to them, not just ask them to come to you, but really trying to leverage the fact that if you have a family unit that could be cohesive, even if it's not right now, that you can leverage that, create social connection. You also want to create positive, healthy, in-person connections. So get them out from behind their screen. Parents, peers, and then caring adults who can serve as role models as well. And that last one is really important for kids who have been through traumatic situations, making sure that they have those caring adults who can serve as role models. You want stable and safe childcare if they don't already have it, and safe and engaging after-school activities that they can do to form connection, to form community, and to build healthy relationships with kids who ideally are also on healthy pro-social paths. You also want to create behavioral and emotional awareness and connection. So on the behavioral side of things, to really help them understand how traumatic responses work and helping them see that potential crossed wire between the past and the present, about how avoidance and safety behaviors, those things like avoidance that you do because you think it's going to keep you safe from a situation, rather than learning that it's actually okay. A very easy example to explain safety behaviors is a child being afraid to jump into a pool for the first time. They're afraid of the water, as much as their mom or dad says, it's okay, like you can jump to me, like you can do it. Until they jump in, they're going to be afraid until they actually stop avoiding safety behavior. I'm safe because I didn't jump, and they jump and they see that they're safe. That's when the anxiety starts to decrease. Conduct yourself with self-respect to raise your self-esteem. And that's a very common theme. When someone feels like they either don't deserve self-esteem or deserve respect, they start acting in ways that disrespect themselves, and that creates a feedback loop. And on the emotional side of things, if a child or anyone can't identify and express their emotions in a healthy way, that's when they tend to go at it in an unhealthy way. So really quick, we're going to go faster through these last few slides because I want to make sure that we have some time for questions before we get to 7:30. So I apologize for picking up the pace here and going through a little more quickly. If you have more questions as well, if time is short, I'm happy to stick around a little bit at the end past 7:30. Or again, please feel free to email me. But all right, speeding up here a little bit. Healthy coping behaviors. There's a number of these that serve to help. First, physical health. Everything is legitimately harder if our bodies aren't right. If you here tonight are a parent, you know you've been through that period of sleep deprivation with newborns, and you know how much harder everything was when you were getting 4 hours of broken sleep a night. Everything's tougher. The same goes for kids. So they got to get their sleep. Exercise and nutrition make a significant difference. Limits on screen time also really matters. Deep breathing and mindfulness also can be really helpful. Mindfulness meditation practice. Again, we're going to go quickly through this for sake of time. I just want to introduce you to the idea of diaphragmatic breathing. This is where you breathe in through your nose. You expand basically behind your belly button out into your diaphragm, and then you breathe out through your mouth. And you know you're doing it right if your belly moves, but not your shoulders. This is actually the only way we can manually bring down our nervous system activation. It activates your parasympathetic nervous system and de-escalates that stress, fear response. There's a lot of ways we can rile ourselves up. Just think about something that aggravates you. The only way that we know to bring our body back down is through this type of breathing. So if this is not something that your child knows how to do, or if you don't know how to do it, I really encourage you go find maybe a YouTube video. I have an audio version up on my YouTube channel that you can use to learn, or just something out there to practice, because it's so helpful. And one method you can use that's been well studied is something called box breathing to activate this, where you inhale, you hold it for 4 seconds, you exhale over 4 seconds. So 4 seconds for each of these, and then you wait before you inhale again. And that can be, if you do that, if you want to keep the 4s for 4 minutes, you will feel the difference. So after we're done with our workshop tonight, if you took 4 minutes, just set a gentle alarm like the buzzing of a smartwatch and gave this a try, I think you'll find that you feel better when you ended than when you started. In terms of mindfulness meditation, very quickly again, I'm just going to put everything up here and get to the end of this slide. Mindfulness meditation is about watching your mind, because our mind, as you saw, I'll bring up that little cartoon again really quickly. Here, our mind jumps around all the time and throws thoughts and beliefs and feelings at us that we didn't ask for and that might not actually be accurate. And so what mindfulness meditation is about not about clearing your mind. That's a very common misconception. It's about watching it. And whenever your mind drifts, coming back to the feeling of breathing, ideally diaphragmatically breathing, to do 2 birds with 1 stone. But it's extremely helpful in terms of not getting carried away by false, hurtful narratives you have about yourself. And again, really deep topic. We could spend a lot more time on it another day, perhaps. But and there's a lot of great apps that you can get to learn about this. More on that in a second. But mindfulness meditation, incredibly helpful for kids as well. In terms of how you calm an activated teen, so say you have a teen who's actively very worked up, you want to start by helping them identify and name the emotion, because understanding how you feel helps to contain it and express it. Support them in calming down, but the body first, then the mind. If you have a child, this also goes for adults, but if you have someone who's flooded and their heart is racing and they're really worked up, the body's got to calm down first, and then you can get to the mind. Diaphragmatic breathing is really helpful for this in terms of bringing that back down. Exercise, nature walks, mindfulness are also really good. It's also much easier if you practice this sort of stuff that helps calm you down in times when you're not stressed out, because then you condition yourself to calm down when you do it, beyond that just actual calming factor of the breathing. There's a part of your mind that's like, oh, I'm breathing through my diaphragm. That means it's time for me to chill out. But you can only add that extra layer on if you've practiced it when you're not already stressed out. You can use the love tactics to discuss those underlying thoughts and feelings. And then you can also model and assist with problem solving. Show them that you can solve problems by thinking it through. Anger and upset is oftentimes rooted in this lack of control, feeling helpless and stuck. And if it's appropriate, you can discuss the outcomes of unhelpful behaviors versus helpful behaviors. But sometimes that's got to wait until the child's calmed down a bit. So again, you can talk through emotions and problems. You can explore the self-regulation domains from that earlier slide from Dr. Schenker. Again, highly recommend his work. I'll have his book up in a minute. But then also, don't be afraid to talk to a therapist. You know, if you've heard anything tonight you didn't already know, that's because I am a licensed psychologist and this is my job. And we're decent people, we're nice people, and we want to help. And it's our job to help. It is not a referendum on you as a parent. Doesn't mean you've done a bad job. There's a lot of reasons why kids really could use the help of a professional. Oftentimes, the way that I like to put out there, like this is how, when do you pull the lever and say it's time to get some help? Is if you stand back and you look at your child and say, like, over the course of the last year or two, or even months, what's been the trajectory of their mental health and functioning? And if it's been going down, that's potentially a yellow or red flag. And the second one is if it were to continue along that trajectory for another year or two, where would they be? And if that answer isn't a positive place, it might be time to get some help because it's not necessarily going to course correct on its own. So just a few other ideas here for you before we move into the Q&A. You want to make sure you reward behavior you want to see rather than just punishing poor behavior. Rewards, we know from research, are far more indicative of future behavior. You reward the behavior that you want to see again. Don't just tell a child what not to do. Tell them and reward what you want them to do. You need to be consistent with positive and negative consequences in parenting. It's critical. It's so hard sometimes for parents to do this, particularly if they're separated or divorced. It's so tough. But if you can be consistent, it is so helpful to the child. It's critical for learning and helps create safety through structure. You want to be on the same page as your parenting structure and take care of yourself and your marriage or partnership if you have one, because as household leaders, you set the tone. And if your emotional or relational health suffers, it flows down to the kids. So in terms of some recommendations for future study or work, if you guys are interested in this, Headspace is the best tool I've found. By the way, guys aren't paying me for this, just my personal opinion. The best app I've found to teach mindfulness to kids, they have a whole suite for that. The 5-minute journal, which the words aren't up there, but that's the icon in the app stores, as a great positive psychology tool to start your day and end your day with gratitude. Another really well-studied principle to help work with resilience and improve wellness and self-esteem. Happify is a really neat app that combines cognitive behavioral therapy techniques with awards, achievements, game theory. It's a really great way of kind of turning self-help and mental health into a game. So really useful. On the book side of the street, these first few are for you as adults. This is Stuart Shankert's book that I mentioned about self-reg. Unwinding Anxiety is one of my favorite books and really helps you understand, particularly again for kids who've been through trauma or other anxiety disorders, what's going on in their mind and how to help them. Permission to Feel by Dr. Mark Brackett is a great book about emotional intelligence. So if you feel like you have a child who's become very closed off from going through difficult times, this can be very helpful in understanding how to help them open up. And back in the mindfulness side of the street again, this is a book written for teens, really good book, Mindfulness for Teens in 10 Minutes a Day. So this can be a structured way of teaching the principles. So to bring this home, take homes for you guys this evening. And again, thanks for sticking with it. I know it's been a long evening of me talking at you, but hopefully we'll have a chance here to answer some questions. Our children need us right now more than ever. They are, statistically speaking, and I feel like if you just look around, you can see a lot more children having a very hard time, and they need us to step up. 1 in 5 kids, this is Suicide Awareness Month, so I'm going to say it one more time. 1 in 5 kids say that they've seriously thought about suicide in the last year, and 1 in 10 have tried it. So we have to change our level of engagement with them. ACEs are common and have significant consequences, but they're not inevitable. That cascade that we talked about earlier in the presentation, that is contingent on not actually dealing with the problems in an effective way. And so there's ways to get in there, particularly when kids are younger, and change the course of where that has to go. It's not deterministic, but we do have to do something about it. These traumatic situations leave memories that create these adrenaline responses and teach lessons that are not accurate. If you think back to those vignettes that we went through, the traumas caused their damage through toxic stress. So you can alleviate that stress by teaching self-regulation and coping. That's again how the third part of the presentation, it's all very linked today. So you teach them how to do these things that gets to the reason why they're struggling and have from as a result of that trauma. Consistently safe relationships and environments are essential to this. Resiliency and healthy coping skills can be taught at home, but please don't be afraid to reach out for help if you need it. There are so many resources that are available to you, and so many agencies, including the folks who put this workshop on tonight. So thank you so much for your time and attention this evening. If you'd like to stay in touch, there's my email, and feel free to subscribe to my quarterly newsletter as well. I'm just starting it up. You can scan that QR code or just go to weinerphd.com/newsletter, and we can stay in touch that way as well. So that being said, I am going to take myself off of this mode where we can only see me, and pitch things back over to Amanda to facilitate the Q&A for anyone who can still stick around.
Absolutely. Again, Dr. Weiner, thank you so much for being here. I want to thank you on behalf of the Mental Health Association of Maryland and our Children's Mental Health Matters campaign. We truly appreciate you sharing this wonderful information with our group here tonight. A few questions that we were not able to answer kind of on our back end. One person was asking to explain the seriousness of bad behavior when the behavior is carried into adulthood and or acted out in adulthood.
Yeah, absolutely. Well, I mean, I think, with at the risk of stating the obvious, things can just get more intense and severe. So I'm thinking right now of a situation where that I hear unfortunately very commonly around kids who struggle with very almost, to be honest, addictive behaviors to their video games or smartphones and iPads, where they almost rule the household through fear, where parents feel like if I confront them about this or taking the phone or the iPad away at the end of the night, there's it's going to be terrible and like a huge fight. And so because they know it's going to be uncomfortable, they just don't do it. And then what they do is they teach their child, their teenager perhaps, that they get their way through being threatening and menacing or throwing a fit, that it's okay to disrespect and talk back to people they love or to authority figures. And if you take that theme and you project that into, well, what happens when they're in a romantic relationship? What about when they're trying to hold a job? What about, there's all of these other factors where that behavior is actually very harmful to them. And even though it's difficult at times, so difficult at times to either be confrontative or to have boundaries and negative consequences or to watch your child be uncomfortable, it is so important for learning and growth. Our role as parents is not to protect our kids from ever feeling discomfort, even though it's hard to watch. Our role as parents is to help create healthy adults. And that means being able to see the connection between cause and effect with behavior. And so if you have a child who's speaking in a disrespectful way, recognize to you, that means either you need to work to correct that behavior with them, or they're going to learn that that's how they get what they want, and they're going to replicate that again as they get older. So great question, but it's so hard to do, but so important to do.
Great, thank you. I also see one more that came in. I have both a church and another place to hold trainings. Oh, okay, sorry, never mind. That was not an actual question. Just someone who is looking for information about some additional services and supports. We had several people ask if the apps and resources that you presented this evening would be shared. We are happy to pass that along to those who were here, as long as you're okay with sharing that information. Lots of kudos and great webinar comments as well. And for those of you who are still here with us, we did put a link into our evaluation form. If you could please click that. It 10 questions. Shouldn't take you too long. We really appreciate that feedback. And if you're interested in continuing to be informed about our Children's Mental Health Matters campaign, we've got lots of great activities planned for this year. You can sign up for our newsletter as well. So you can get lots of great things in your email between our newsletter and Dr. Weiner's newsletter also. Again, thank you so much, everyone, for being here. Dr. Weiner, thank you for your wonderful presentation and for sharing your knowledge with us. And we hope you all have a wonderful rest of your evening. Take care.
Thanks, everyone. Be well. Take care.